welcome back to the Pelvic Health Summit. I'm here with Dr. Kathryn Witzeman. She is a director at the Women's Integrative Pelvic Health Program at Denver Health Medical Center. She is an associate professor at the University of Colorado School of Medicine in the Obstetrics and Gynecology Department. She herself is an OBGYN, and she sits on the executive board of directors of the International Pelvic Pain Society. Welcome.
Thank you, Pamela.
I'm so happy to have you here. Can you please tell us a little bit more about your approach and practice?
I think one of the most important things about our practice is that it's very integrative. We at the Women's Integrative Pelvic Health Program at Denver Health, we are a whole team, and we are a team of healthcare providers from a variety of different disciplines that work with women who have pelvic pain disorders and other pelvic health problems. And we include myself, who's an OBGYN, and other gynecologic providers, as well as a gastroenterologist, pelvic health, pelvic PTs, pelvic physical therapists, health psychology, women's health psychiatry, urogynecology. We have a very holistic program and work towards helping women in all aspects of their pelvic health disorders and condition.
Awesome. So what can you tell a potential patient? What would you like them to know before they come in and see you?
So I think it's important for women to understand that pelvic pain disorders are complex, that it may take more than one visit, and usually does take more than one visit, to try to figure out what's going on in their individual situation. And that because we work as a team, that they'll likely be seeing, that we'll likely encourage them to see a number of different healthcare providers in our program. Because when a woman is struggling with a pelvic health condition, many times it's impacting her life in a lot of different ways. And so it's not just her own, it's not just the symptoms she's having, but it's the impact it's having on her whole life. And so we try to address that as her as a whole person.
That's so important. And what's really cool about what you've done with this team of practitioners, that's kind of the conversation we're starting, and what we're seeing practitioner after practitioner saying is you need a team, you need a support around you. And that's so great that people who are local to you can benefit from that. Let's get into some of the conditions that you see often in your practice and that you treat.
So one of the most common presenting symptoms that women come to me as a gynecologist for is with sexual pain or pain with intercourse. They also may come with very painful menstrual cycles or just pain outside of the time of menstrual cycle that occurs. The pain can be anywhere from their belly button down to their upper legs, and women come with all different kinds of problems in that area. Sometimes they'll come with painful urination or pain with bowel movements. Could be pain with menstrual cycle. There's a lot of complexity in the abdomen and pelvis, and women can present it in many different ways, and sometimes with one, more, or all of those symptoms.
Definitely. And getting into the symptoms, are there any common symptoms that you see over and over again that have been maybe misdiagnosed and they ended up at you and you were able to kind of bring some clarity around that?
Sure. I think one of the common things that women come to me as a gynecologist with is thinking that their symptoms are all coming from their reproductive organs. And many times they're not. In fact, much of the time they're not when we do a full evaluation. And so that's why a whole team is really important. There is a lot going on in the abdomen and pelvis. You have your not only your reproductive system, but also your gastrointestinal system, your digestion, your urinary system. So making and passing urine, your sexual response cycle can be impacted. And other times, it's actually more neuromuscular. And so a lot of women will actually have neuromuscular problems and relate them to their reproductive organs, or think that they're coming from some other area in their abdomen and pelvis. And this is really common. There's a lot of confused signals within the pelvis, or signals that can be confused within the pelvis.
That's definitely helpful. One of the questions that we've been asking is, what are common myths that patients come in with? And you definitely hit upon some of those, because there's just been, what's so great about a specialist like you is that you focus on the pelvis and that region, so you can see all of the different aspects of the body that can relate to it and trigger it and whatnot. So you mentioned painful sex a few times. Would you mind going into that, even describing some of the symptoms and different conditions that you work with patients around?
So as I said, as a gynecologist, painful sexual intercourse is one of the most common reasons that will bring a woman into the office. Many times they've been suffering with other pain problems, but when it becomes painful intercourse and it's impacting the relationships, the intimacy, and the complexity of the relationship, that is what gets them to come in many times. So really addressing that painful intercourse is not normal, and we can do things to treat that and get down to understand what actually is causing the pain with intercourse. Painful intercourse is really complex. As you probably have heard, do you know what our biggest sex organ is actually? The most important sex organ. Yes, the most important sex organ. Yes, it's the brain. It's the brain. So even though many women focus on their genital region, it is the brain. And so when women are having painful intercourse, and they continue to do so, they're connecting pain with something that shouldn't be painful, something that should be pleasurable. And do you want me to go on from there?
I mean, I think another question I would like to ask is, what are some contributing factors and conditions that lead people to experience painful sex?
When a woman comes in with painful intercourse, we have to determine, because there can be so many different things that are contributing to that, we have to parse that out and try to figure out all of the different contributors so that we can treat those. And one of the things that we recommend as we're trying to figure this out is that women abstain from something that's painful, any type of sexual interaction that's actually painful, because we don't want to reinforce that connection between the brain and the pelvis, saying that sex is painful. We want to not make that connection stronger, that pathway stronger. So we do ask that women abstain for a period of time until we figure out what is contributing. Things that could contribute could be the tissues of the vulvar region, could be inside the vagina or the pelvic floor muscles, and the nerves that go through the pelvic floor muscles can also contribute. And the autonomic system is a really important part of pelvic pain disorders, because it connects all of the different organ systems. Our autonomic system connects to our bladder, our intestines and digestion. It connects to the reproductive organs, and connects the nerves of the muscles around the pelvis and the pelvic floor. So it's one of those things, if the autonomic system becomes upregulated, that can impact any of those different body systems and lead to painful intercourse.
Can you tell us a little bit more about pelvic pain with pregnancy and postpartum?
Sure. During and after pregnancy. Pelvic pain, pregnancy is a really common time when women will present with pelvic pain, which may or may not be related to intercourse. It could just be when they're walking around or sitting or getting up and standing. And Obviously, pregnancy is a time of great change for women. You have lots of hormones coursing through your body that are changing, not only supporting the pregnancy, but also changing your musculoskeletal system and causing the pelvis to be more, sometimes more unstable. And these connections within the pelvis, because of the hormones of pregnancy, can become unstable, causing more instability both with the pelvic floor and also pelvic girdle muscles that are around the pelvis and support lots of activities like walking, climbing stairs, lifting, and can also, because they work with the lower back and the abdomen and core, they all work together. And during pregnancy, as this is a time of great change where they can be impacted. So it is a common time for women to present with pain. And another very common time is during the postpartum. So after they've had the baby. And this many times doesn't get recognized until much further down the line. But because of changes during pregnancy or during the birthing process, even if the C-section is the way the baby is delivered, a woman can develop pain from the abdominal wall, the pelvic floor, nerve issues that can happen because of healing processes after the birth of the delivery or after the birth of the baby. And so the postpartum healing time, the postpartum period and the healing that occurs during this time is super important and super important for women to understand they need time to heal, and that when they do eventually go back to intercourse or trying to have intercourse, that if they're having pain, then they need to see their healthcare provider right away. They need to, it's not normal after having a baby to have pain with intercourse after the healing process has occurred. So typically we don't recommend any type of penetration for 6 weeks after the baby, but it takes longer than 6 weeks to fully heal for many women.
We haven't really spoken very much during the summit about pregnancy and postpartum, so since you are such an expert in it, I just want you to share everything.
We could talk about breastfeeding too, if you want, and what causes. Many women will also develop pain with intercourse during the time that they're breastfeeding. And part of the reason that is that breastfeeding changes our hormone levels, and our estrogen can drop during this time period. And the tissues within the vulvovaginal region are very responsive to estrogen and need estrogen to be healthy, and so may become more fragile and drier during that time period. So there are definitely things we can do to help that. So if women, it's important if women develop pain that they never had before with sexual intercourse, after they've had a baby, we want them to come in and get help early.
Definitely. Is there any kind of preventative measures to get the pelvic floor as fit as possible if we're preparing for pregnancy?
That's a great question. And, I'd actually say it's a better question for one of our pelvic physical therapists as far as recommending exercises to strengthen the pelvic floor before pregnancy. One of the things that we have to be cautious about is after pregnancy, we do want to strengthen the pelvic floor and the core, but we have to be very careful not to stress it while it's still healing. Just as if you had injured another muscle in your body, say you had pulled your quadricep muscle, your thigh muscle, running, you wouldn't go back to running right away until it healed. You would want to allow the muscle to heal. And the same with the pelvic floor. You don't want to stress the pelvic floor too quickly. Yes, it's important to strengthen the pelvic floor, but getting it healthy before you do that is very important. We can talk about attitudes and perceptions for a little bit. It's interesting in the field of OBGYN, pelvic pain has been a condition that OBGYNs have seen for a long time, but there's always been a focus on the reproductive organs. And when the reproductive organs aren't the cause of the pain, then many times traditionally trained OBGYNs will have not feel prepared in how to address all of the issues. And that's why a team is important. I have done some research and looked at our learners in OBGYN, some of our residents, and they many times feel very overwhelmed and not fully prepared to help women with all of their needs. And that's something that we're working on. We're working on education, trying to educate all healthcare providers, primary care providers, OBGYNs, medical students who go into all kinds of fields, and educate them about pelvic pain disorders and the complexity of them and how to fully evaluate and patients and or women who come to them presenting with pelvic pain concerns and symptoms.
Definitely. That's so important, especially to just have more practitioners start their professions with this knowledge and then now just build upon it. That's really what the summit and all the awareness for May is about. Can you tell us a little bit about specific conditions that you see often? Like for some of them that we can maybe go into is PGAD, vulvodynia, endometriosis.
Mm-hmm. So I do see women with, as I said, painful menses or dysmenorrhea, which can have many causes. Endometriosis is only but one cause of painful menstrual cycles. Vulvodynia is a term that gets thrown around a lot, and really what it means is that there's pain of the vulva, and we haven't figured out what the cause is yet. There are a number of underlying causes that need to be evaluated for before you can say that a woman actually has vulvodynia, that we can't figure it out. Mm-hmm. And usually when that's the case, it comes down to the nerves and the muscles that need to be addressed and evaluated. Certainly there are lots of, we need to eliminate vulvar infections or skin disorders, hormonal problems, as well as nerve and muscle issues to be able to say that someone has vulvodynia. So it's the smallest percentage of women who actually truly have vulvodynia. We need to be able to diagnose it better.
That's really helpful information. And you have been touching a little bit about how hormones play into the picture of pelvic pain. Would you mind telling us a little bit more about that?
So hormones can play in a multitude of different ways. Obviously, as I think I was saying earlier, that estrogen is important in the health of the vulvovaginal tissues. And when a woman's estrogen has dropped for many different reasons, could be postpartum, as we were talking about, could be in the perimenopause phase or in menopause, then those tissues will change because of lack of estrogen. They can become more fragile, drier, and definitely more susceptible to developing pain and painful intercourse because they are more fragile and drier. And we need to look for those causes. Certain medications can also do that, and that should be evaluated as well.
So when someone's in perimenopause or in menopause, have you seen, is that a common time when people will start presenting with pelvic pain that maybe didn't show up earlier?
It certainly can be, and we need to evaluate for, as I said, potential for hormonal changes or other causes that can occur at that time frame. And when we're evaluating a woman, we're doing a complete, thorough history, looking at all of the different systems, evaluating all of the different systems that can be contributing to their individual situation. So that's an important piece of how to figure that out and figure out what is contributing.
Can you share with us some success stories?
Sure. We have lots of success stories in our program. And many of them can be surprising, and women can actually, they do incredibly well with the integrative approach. It's interesting, one particular lady had a really interesting presentation. She was sent to me, again, for painful intercourse and increase in pain with her menstrual cycles. In talking to her, she had about 9 months earlier actually had a pelvic fracture, and she didn't have to have surgery. She had physical therapy for the pelvic fracture. However, in the whole process of healing from her pelvic fracture, she had had compensating problems with the pelvic floor, which ultimately led to pain with intercourse, and then an increase in pain with her menstrual cycle. And when we identified that and it would have been hard to identify without getting a very thorough history and doing a thorough exam. When we got her to a pelvic physical therapist, she did wonderful. Within 6 to 8 weeks, she had been able to rehabilitate the pelvic floor, and by 12 weeks, she was doing very well, and was very happy with her outcome.
Awesome. So for other gynecologists out there who might be watching who haven't specialized in pelvic pain conditions, do you have any resources to share with them if they want to broaden their expertise?
Well, certainly, I have to be biased as an executive board member of the International Pelvic Pain Society. I think that we have wonderful resources on our website and wonderful education that we put on every year at our annual meeting for healthcare professionals. There are also lots of books and articles, but many times busy frontline healthcare providers don't have the time to dig into the literature. And so going to a meeting is a great way to really brush up on their knowledge and what's new and happening in pain, in the pelvic pain world, I guess you could say.
For viewers out there watching, what can people out there look for or expect from their gynecologist when talking to them about pelvic pain?
I think if a woman, when they're first presenting with their symptoms, to do it as early as possible, not to wait, is number one, as well as trying to think about all of the different systems that are in the pelvis. Have they had not only pain with intercourse, but are they having any digestive problems, any urinary problems? Have their menstrual cycles changed? Have they noticed sleep problems? Have they noticed other symptoms that can play into pelvic pain disorders? That's hard for a woman to kind of put all that together. Ideally, a healthcare practitioner is going to ask a lot of those questions, but if they're not asking those questions, and a woman feels like she isn't getting the answers that she needs, looking for a healthcare provider that has expertise in pelvic pain, but also it has a holistic approach is important to try to make sure that we are not just treating one aspect of the pain, but treating the whole person, the whole woman.
Before we sign off here, would you mind sharing with us a message of hope?
Yes, so many women come to our program and they have seen healthcare provider after healthcare provider. And what I really want women to understand or to feel is that there is always hope. There is always that no matter how long you have been suffering with pelvic pain or other related disorders, there's always hope for feeling better and then for improving your quality of life. And we would love to be able to help with that. So I think, just really in summary, for women to feel that there's always hope.
There's always hope. That's one of the things we're really trying to hone in, but also raise the point of not just getting to the place of manageable pain, getting to the place of possibly no pain at times, and also feeling better. I think as women, we think suffering is normal, and like you mentioned, like painful sex is not normal. So
Right.
raising that standard in ourselves and each other, and that's one of the things we'll definitely take away from your interview.
Yeah, no, I think that is very important because sexual health is an important part of any person's life. It is important to have hope, to regain normalcy to a person's intimate life, and we believe that there is always hope to improve and to bring normalcy back to a person's life and overall pelvic health.
Thank you so much for being here with us. Can you tell us where we can find you?
So I am at Denver Health Medical Center, and again, I'm the director of the Women's Integrative Pelvic Health Program. The easiest way to find us, I think, is probably Googling. If you Google pelvic health, Denver Health, you'll find us.
Okay, fabulous. And then for people local to the Denver area, you can definitely reach out to their website, and I'm sure there's a lot of great resources on there for everyone who's out of the state and international. All right, thank you so much for being here.
You're very welcome. Thank you, Pamela.
Thank you so much for joining us. Now I'd like to hear from you. Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.